Thanks for joining us for a summary of this information piece on health funding in British Columbia. Last year, health sector spending in BC totaled $19.2 billion. Of that, the Ministry of Health spent $17.4 billion, or 37% of the overall provincial expenses. To put this into perspective, this is 3 times more than what the next largest ministry spent, and that's education. The Ministry of Health splits that money among 3 main recipients. First, the province's 6 health authorities received $11.8 billion to deliver care to the people of BC. Second, the Medical Services Plan received $4.2 billion, mainly to pay doctors. And third, Pharmacare received $1.2 billion for prescription drugs, dispensing fees, medical supplies, and pharmacy services. BC spends an average of $4,050 per person on healthcare each year. That's close to the Canadian average, which is $4,095. Since our 2013 report on this topic, spending in some areas has gone up, but in others it has gone down. Areas like acute care, residential care, community care, and mental health and substance use services are seeing more funding. Spending in public health and wellness, like prevention programs and communicable disease control, has gone down by 1%. The healthcare sector faces some of the biggest funding pressures in government. For example, a significant portion of our province's healthcare funding comes from the Canada Health Transfer. This is money the federal government sends to the provinces and territories to help pay for healthcare. Last year, BC received $4.5 billion. Since 2004, the transfer has grown by 6% a year, but as of this April, it will only grow at about 3% a year. As a result of the drop, the provinces and territories have argued that this will lower the amount of federal support for healthcare from 23% to 20% of overall provincial budgets. Under the recently signed agreement with Health Canada, BC will receive the minimum annual increase as well as an additional $1.4 billion from the federal government over the next 10 years. The health sector also has the greatest spending pressure in all of government. Between 2013 and 2018, healthcare expenses are projected to increase by $2.7 billion. This is more than the combined budgets of the 11 smallest ministries, or the budget for the 3rd largest ministry, Social Development and Social Innovation. Rising healthcare costs may threaten the provincial government's ability to provide services and meet financial commitments, both now and in the future. This is something we noted 2 years ago in our report on monitoring BC's fiscal sustainability. We issued our first information report on health funding in 2013. This report is an update, with new data and insights about the complex world of health funding. Information on healthcare costs in BC is in high demand, but not always readily accessible. So, we pulled much of it together for easier viewing. Our intention is to show how health dollars flow through the system. We didn't audit health spending or any aspects of the Ministry of Health in this report. That's our summary for today. Thanks for joining us. And to read this report and others, or for more information about our office, please visit our website at www.bcauditor.com.